Hello there, my name is Dr. Emma Davies and I'm a reader in psychology at Oxford Brookes University. And together with my colleagues, Dr. Jennifer Seddon, Catherine Lilliard and Professor Ida Watson, we are delighted to be embarking on a new project funded by Prevent Breast Cancer. So our project is going to involve co-producing a behaviour change intervention to reduce alcohol consumption in midlife women. And we're defining midlife women as those aged 40 to 65. And this is a really important group of people to focus on in research for three really important reasons. Firstly, around prevention and awareness. So we know that alcohol consumption is a significant preventable risk factor for breast cancer in women, but awareness of this information is very low. Secondly, it's important because there's a dose-response relationship. So this means the more that someone drinks, the more their risk levels rise. And these risks build over time. So while 8 out of 10 cases of breast cancer are diagnosed in women over the age of 50, earlier reductions in drinking are needed for a preventive effect. And thirdly, there is a real lack of research on drinking in midlife women. And some data suggests that midlife women might be drinking more than younger women. So in my team, we've already conducted some previous research on this particular age group, and we conducted some focus groups, and we found that our participants were really unaware of the links between alcohol and breast cancer. And they also felt that information that was aimed at reducing their drinking sometimes felt a bit patronising, vague or judgmental, and it sometimes ignored the benefits that they got from drinking. And these participants told us that if any interventions or information designed to reduce them to stop drinking or reduce their drinking ignored those benefits, then it would be unlikely to be something they'd listen to. So we want to ensure that any interventions we develop don't just take something away from people, but they enhance their lives. So the aim of our new project is to extend this previous work. We're going to identify some intervention content, so messaging approaches and behaviour change techniques to increase knowledge about alcohol and breast cancer risk, and also to support women to reduce their alcohol consumption as well. And we'd like to prioritise the experiences and knowledge of the target population when we're developing interventions in our research group. So we have a public advisory group in this project who are going to share responsibility for the project and its output. So one of the main pieces of research we're going to conduct will be a Davies study. And this is a kind of study which involves getting expert information and views. So the experts in this case are women themselves, aged 40 to 65, to give you their information and to build a consensus on the course of action for the intervention content that would be the most appropriate to use. So we're going to have 3 rounds in that study: questionnaire with a large number of people, then a focus group, then a workshop. And in the workshop, we'll develop a consensus statement about the best intervention content and behaviour change techniques to use. We're then going to use that information to draw up a prototype of the intervention together with our public advisory group. And that's something we can then apply for further funding for to see if that would be feasible and effective in the future. So the main outcome of the current project will be to provide new information for midlife women aged 40 to 65 about what they think are the most useful tools to assist in reducing alcohol consumption and raising awareness of the links between alcohol and breast cancer. We're going to disseminate these findings widely. We're going to create an animated infographic, which is something that can be really easily shared on social media. We're going to host a webinar, we're going to write blog posts and media articles. And all those dissemination activities are planned for January 2024, which will hopefully mean we can increase the reach and coverage of that information because it coincides with Dry January. So thank you very much indeed for funding our project, and we look forward to working with you.